When I was a senior in high school, my dad called me while I was at the movies with some friends, and he ended up leaving a voicemail. And after I got out of the movies, I checked the voicemail, and he had said that he collapsed at work. And he told me not to worry, but of course I did, and my friends took me to the hospital to see what was wrong. My dad had had a few collapsing issues in the past, but he's so stubborn that he didn't want to do anything about it, but his coworkers took him because they realized that he needed to get taken care of. He told me that it was his heart, and I needed to know exactly what was wrong and how to be able to make him feel more comfortable. I've done research both now and back then, just on different types of heart disease and on my dad's in particular, so I could better understand his condition and how to make him more comfortable. And today I'm going to inform you of 3 types of heart disease that affect people today, discuss 3 treatment options that are available for heart disease, and how to prevent heart disease now. To begin, I'm going to inform you of 3 types of heart disease, one common, one more intermediate, and one rare heart disease. The first is coronary artery disease, which is the #1 killer of Americans, and it's the disease that's most often associated with the term heart disease. It involves the hardening and narrowing of the arteries, which in turn produces blockages in vessels that maintain the heart itself. Symptoms for this include shortness of breath, faster heartbeat, nausea, and sweating. The second one is aortic stenosis, which affects the aortic valve, and this is the disease that my dad had. The aortic valve opening is smaller than normal because of stiff or fused leaflets, and the narrowing causes the blood to have to work harder to pump through since it's restricting the blood flow. And the symptoms include difficulty catching breath, dizziness, passing out, and irregular heartbeat. And then Marfan syndrome is an inherited genetic disorder that is more rare. It affects connective tissue that gives strength to heart valves and other organs. It can weaken the inner layers of the aorta and cause it to split open. It's unable to tell if somebody has Marfan syndrome, and in turn it's hard to tell if they have heart problems with that syndrome because the disease itself is difficult to detect. But those who do have Marfan syndrome are usually very tall, slim, loose jointed, flat footed, and narrow faced. Now I'm going to present you with 3 options for treatment of heart disease. The first is angioplasty, which is a non-surgical procedure that's used to open blocked arteries. A catheter is inserted into an artery, typically in the groin area, to take a picture of where the damage is, and the procedure that is used following the photograph depends on what is wrong. Stents are one example, then they help to keep the coronary artery open. Another procedure is valve surgery, which is what my dad had. The incision is made down the sternum for direct access to the heart to repair valves depending on what the damage is. It can be performed on the mitral, aortic, pulmonic, or tricuspid valve. If the valve can't be repaired, it has to be replaced with a new valve, which was the case with my dad. There was no way to repair it, so they replaced it with a pig valve, actually, because animal tissue valves are able to give support even in the human body. And the final treatment option is bypass surgery, which is where the heart is stopped for part of the surgery but is connected to a bypass machine so the blood can circulate. And it's used when coronary arteries are clogged to give blood a new pathway to the heart. And a blood vessel is removed or redirected from the chest, leg, or arm to the affected area to bypass blockage and restore the blood flow. My dad actually had to have bypass surgery after his valve surgery because he had an unexpected artery clog. So after he had been cut open once, they had to go back in and cut him open again. So that was not fun. That was very scary. But to conclude, I'm going to present 3 ways to lower risk of heart disease now. The first is to develop a healthy diet. Diets with a high intake of fruit, vegetables, whole grains, and fiber are related to a reduced risk of heart disease. Intake of fried foods and foods with a high butter, fat, sugar, or salt intake should be limited. The next thing you can do is have a routine exercise plan. Even moderate activity like brisk walking can reduce heart disease. Exercise should take place 3 to 4 times a week for at least 30 minutes, and the routine established should be maintained, and then it's important to stay hydrated while you're exercising. The last thing to do is to manage your stress. Stress that is uncontrolled can lead to heart attacks. So some ways to relieve stress are deep breathing techniques, use of proper time management, yoga, positive thinking, laughing, and prayer is always a good one too. So I have now presented you with information on a few types of heart disease, explained three treatments that can be performed to aid in controlling heart disease, and how you can manage heart disease before it happens. Both of my father's surgeries were successful, and he now shows little abnormality with his heart. He participated in rehabilitation and took the steps that he needed to improve his heart health. If he would have gone to the hospital the first time, the issue probably could have been resolved a little bit quicker, and I wouldn't have been as stressed out about it as I was. But he's, like I said, he's very stubborn, and I'm just happy that he's still alive. So being aware of the negative effects of heart disease and how to lower risk of it now can save you a trip to the hospital or even your life.
Let's have cake.